Okay, so today we're going to talk about, is upper cervical adjusting safe? I went on the internet, did a little searching. What does the internet want to know about upper cervical care? And this was one of the top searches. So I'm Dr. John Stenberg. I'm an upper cervical chiropractor, and we're going to tackle the research related to this topic. I'll share a little bit about my opinion, but I'd rather just present the evidence and you can make an informed decision about what's right for you. Now, when folks are asking, is upper cervical adjusting safe? I think there are maybe 2-3 questions behind the question. So I wanted to bring some research related to those two questions in particular, which would be, are folks being injured or having a symptomatic negative reaction to upper cervical adjusting? Because we always want to feel better, not worse, right? And the other question is there a risk of stroke if someone's working on your upper neck? So we're going to handle those two questions from a research-based perspective. But first, let's address who might not be a good candidate for upper cervical care to prevent, hopefully, any adverse reaction or negative experience with upper cervical chiropractic. Now, hypermobile conditions such as craniocervical instability, hypermobility conditions like EDS, Ehlers-Danlos syndrome, or other connective tissue disorders, probably not great candidates for upper cervical care, or certainly not traditional manipulation. As you'll see, one of the goals of upper cervical care is to do an adjustment that has a systemic health benefit, but also one that lasts. And these conditions provide a certain barrier or significant barrier to holding. So there may still be benefit, but each situation in these category of conditions should be handled very carefully and on an individualized basis. Additionally, pain related to more emerging conditions like cancer, infections, a failed surgery are not going to be great candidates for UC care, at least when a more emergent conditions need to be dealt with. So, as always, discuss your treatment options with your healthcare team so that you can make an informed decision about what's right for you. And if you do consult with an upper cervical chiropractor, they should do a thorough evaluation and history to understand if you're going to be a good candidate or not. And we'll talk about how to find a qualified doctor later. But let's get right to the topic of safety. And we're going to start with the risk of vertebrobasilar stroke in chiropractic. You can't talk about upper cervical adjusting without talking about stroke. So the Cassidy paper here, published in the Spine Journal in 2008, is a landmark study on this topic. And we'll discuss a few of the relevant findings here. Quote, the prevailing theory is that extension and or rotation of the neck can damage the vertebral artery, particularly within the foramen transversarium at the C1 and 2 level. However, most cases of extracranial vertebral artery dissection are thought to occur spontaneously, and other risk factors such as connective tissue disorders, migraine, hypertension, infection, levels of plasma homocysteine, vessel abnormalities, the list goes on, could be identified as possible risk factor. So this paper looks at the case-controlled studies following neck manipulation, and I won't bore you with the details. I'll put the link to the paper here, but let's discuss some of the results. A total of 818 VBA strokes met our inclusion-exclusion criteria. So a total of 3,164 subjects were matched to the cases. And let's get into the findings. Over 4% of cases and controls had visited a chiropractor within 30 days of their index date, which is the stroke date, while 53% of cases and 30% of controls visited a primary care provider. Each chiropractic visit in the month before the index date was associated with an increased risk of VBA stroke in those under 45 years of age. Our results were sensitive to chiropractic and PCP-related visits, to neck complaints and headaches. So, again, let's get on to some of the details about this paper. Let me just actually translate some of this terminology for you, okay? Basically, the findings of this paper are important in a couple different ways. Patients under 45 years old with acute head and neck pain related to stroke were 3 times more likely to have visited a chiropractor or primary care provider before their stroke. That makes sense, right? They're seeking relief from symptoms that are in the realm of chiropractic care, headaches and neck pain. Interestingly enough, this trend was not measured in patients older than 45, but when it comes to associating stroke with chiropractic visit, there's a similar association, according to the Cassidy paper here, with visits to the chiropractor and visits to the primary care doctor preceding the stroke, and even a slightly higher association with PCP visits, which I'd imagine has something to do with the fact that more folks will see a primary care provider than as a subset of the population than chiros. But of the nearly 900 patients who were followed in the study, going to the PCP and having a stroke is just as likely and maybe slightly more likely than visiting a chiropractor. So this is a very important point related to safety. The association between stroke cases that presented to both the chiropractor and the primary care provider have everything to do with the presenting symptoms, the neck pain and headache. And these are symptoms that can develop when someone is experiencing a vascular event. So you can rest at ease knowing that it's very unlikely that any chiropractor can adjust your neck hard enough to tear those arteries and cause a stroke. That being said, those folks that did see a chiropractor or primary care provider for that matter basically had a stroke brewing. The symptoms brought them into the office, and then the chiropractor or primary care provider then needs to do an appropriate job of screening the patient to make sure that it is a musculoskeletal versus vascular problem, rather than randomly having a stroke because they were adjusted. So be sure that any healthcare provider that you're visiting, if you have these types of symptoms, is doing a thorough assessment and not offering a one-size-fits-all treatment approach, because in these situations, regardless of what doctor was seen, the need for appropriate screening is crucial. Okay, so let's move on to less dramatic adverse events. And this is a study that was published in the BMC Journal of Musculoskeletal Disorders in 2015, and this is a symptomatic reactions, clinical outcomes, and patient satisfaction associated with upper cervical chiropractic, a prospective multi-center cohort study. What does that mean? This was a study that was designed and then done on a future basis rather than looking back at cases and cherry picking our favorite reactions. And a multi-center cohort study means this was done across a variety of different upper cervical clinics. So what does this research say about having an adverse reaction to an upper cervical adjustment? Now, over the course of 1,090 upper cervical patients and several thousand visits over the course of a couple weeks, 31% reported mild symptomatic reaction, things like tiredness, neck pain, headache, dizziness, that lasted less than 24 hours duration. And another cool point from this paper is that despite a few minor transient musculoskeletal reactions, patients were overwhelmingly satisfied with their results over a 3-week duration of care. And results included significant decreases in pain intensity with conditions such as back pain, neck pain, headaches, and more. And on average, it only took 2 or 3 adjustments over the course of several weeks to achieve those results. So, very cool paper looking specifically at what possible adverse reactions could happen with different types of upper cervical techniques, advanced Atlas orthogonal, advanced orthogonal, Blair, knee chest, NUCA, orthospinology, toggle recoil. So there's a handful of different upper cervical procedures that were tested in this study. The 5 most frequent symptomatic reactions following upper cervical adjustment were tiredness, radiating pain, neck pain, dizziness, headache, with mild intensity, short duration, and little effect on upper cervical on daily life. So patients also reported very high degree of satisfaction, rating a 9.1 out of 10 using an 11-point numeric rating scale. So again, you can rest at ease knowing that if you were to have an adverse reaction, it would be mild, it would be short-lived, and it would probably be similar to what you would feel if you went to a gym or experienced any type of musculoskeletal strain, and it would last a very short amount of time. Now, it's important to note, and we kind of reference this here, that there are a variety of different upper cervical procedures out there. Okay, so there's a lot of different ways that upper cervical docs may adjust the spine or evaluate patients. And you may have heard of some of these if you're searching, such as Blair technique, Atlas orthogonal, NUCA, to name a few. Now, when it comes to any advanced procedure, it's my personal opinion, you should seek the help of a qualified professional. As you can see in this paper published in 2015 called Craniocervical Chiropractic Procedures, a précis of upper cervical chiropractic. This paper attempted to evaluate all the different upper cervical procedures, their similarities, their differences, and give you some insight into the different options that you have available to you. Talking about theoretical mechanisms, it's speculated that the atlas misalignment affects the nervous system through altered weight bearing on the occipito-atlantal axial joints, stimulating joint mechanoreceptors. What does that mean? If the upper neck and head and neck region are out of alignment, it creates a negative neurological consequence to the body, and there can be a variety of different symptoms related to that. So they evaluate different upper cervical techniques from their assessment procedures. One of the primary goals is to avoid unneeded adjustments, to quote, and these assessments are used primarily to determine when to make an intervention. And so it goes through a process of understanding the different assessments available, how the different upper cervical procedures use them, things like daily checkups of posture, range of motion, neurophysiology, but then also imaging procedures and x-rays that will help determine what needs to be adjusted, if anything, and then a review of those upper cervical adjustment procedures and how they may be performed. They quote the safety and efficacy study there that we just referenced, and also a few others. A records review of UK chiropractors delivering upper cervical adjustments reported minor side effects were common, but the risk of serious adverse event immediately or up to 7 days after treatment was low to very low. So this safety and efficacy study also goes into some of the literature on different types of conditions that are amenable to upper cervical care and the results that have been published regarding those. You can see multiple sclerosis and other neurodegenerative disorders, fibromyalgia, headache and migraine, chronic fatigue, scoliosis, and then some other miscellaneous papers to review as well. Conditions related to research to review as well. So all of these upper cervical chiropractic techniques have standards for testing, training, and certifying to ensure quality control when it comes to upper cervical chiropractic. So if you're seeking or consulting with an upper cervical chiropractor, ask them what technique they're certified in. Or if you'd like to start the search with who's qualified, you can look at the directories in the description of the video here that will identify those doctors in your area or close to you, hopefully, so that you can understand who has been trained rigorously, tested, and certified as a qualified upper cervical chiropractor. So that's what I have for you today on the safety of upper cervical chiropractic. We've reviewed some of the relevant research on the topic so that you can be armed with information to decide with consulting with an upper cervical chiropractor makes sense for you. If you have other questions, leave them in the comments below and we can handle those. I would hesitate from leaving questions that have very specific details related to your condition. Those would be comments and questions that should be addressed face-to-face with an upper cervical chiropractor or your healthcare team. But thanks for watching. If you have other questions related to safety, review these papers and leave them in the comments and we can address those.